Hello, this is Doctors Rohitgandhi and Emily Conrad, staff emergency physicians from Hôpital Montfort. Due to the precautions required for the novel coronavirus, protected code blues on the floor pose significant new challenges in the form of resources, communication, and access to equipment. In collaboration with nursing colleagues, we have developed a standardized strategy for protected code blues on the floor, and this video will serve as a standardized approach that we can all use.
When a patient is identified without a pulse, the first responder, usually the patient's nurse, will call a code blue and shout for help. Once the code blue is called, make sure to 1. Put a surgical mask on the patient, 2. Ensure you are wearing droplet contact precautions, and 3. Start CPR without delay.
Once the second nurse arrives to the code, they should 1. Clearly identify themselves as the second responder, 2. Ensure they have droplet contact precautions, 3. Bring the crash cart outside the room, 4. Bring the Zoll defibrillator, pads, and backboard inside the room. Once in the room, the second responder should place the Zoll and pads by the bedside. Then, help place the backboard under the patient with the other RN's help.
Next, the second responder should apply the mask to any other patient in the room, close the curtain, and move the bed as far away as possible from the patient. Once the second responder has moved the other patients away, they should take over CPR from the first responder. They will allow the first responder to leave the room and don full airborne contact droplet precautions.
While all of these steps are ongoing, one staff member should don droplet contact PPE and come inside to help with CPR. They can bring in a step stool to help with CPR if the bed does not lower. The floor clerk, or any other staff, should also be printing the patient's history and physical admission note, and the latest progress note to give to the code team.
Good CPR is life-saving. Let others know when you are tired.
Once the patient's RN re-enters the room, they can then help take over CPR until the code team arrives. The second responder and extra help personnel should stay in the room as well to rotate through CPR. They do not require full airborne PPE.
Once the code blue team arrives, they will identify themselves and don full airborne contact droplet precautions prior to entering the room. The ICU RN is responsible for bringing the COVID intubation equipment bag. The ED-RN will be responsible to ensure proper PPE placement for those entering the room if there is no PPE officer.
You may notice the code team will have N95 and airborne PPE when they arrive. If you are doing CPR or assisting in the room, don't be alarmed. The airborne PPE is only required during intubation, and you will be asked to leave prior to this. These are the roles of the code blue team. MD1 leads resuscitation, helps place the defibrillator pads and Lucas machine. ICU RN leads bedside resuscitation, helps place monitors and pads, helps with the Lucas machine. Let's watch. The ICU RN helps to place the pads. The team member performing CPR and the ICU RN or RT will help roll the patient while MD1 places the base of the Lucas machine. Keeping the patient's arms out of the way, the Lucas is attached and set to continue with CPR. The role of the ICU RN is to obtain IV access, communicate with the ED-RN outside of the room for medications and items required. RT1 helps to manage the airway, provide free flow oxygen, and prepare for possible intubation.
Once the Lucas is on and set to continuous CPR, the patient's RN can now stop CPR and begin to document. The second responder and extra help personnel can now leave the room. If doffing will delay intubation, they should not doff inside the room and should doff outside the room.
With regards to the roles of the members outside of the room, the ED-RN's role is to 1. Bring the red ED medication bag and 2 walkie-talkies to all codes. 2. Ensure PPE is adequate for the code blue team. 3. Don themselves in full airborne contact and droplet precautions. 4. The ED-RN will also be handing out name tags to all members of the team to place on their gowns. This is an important step to help identify the teams and roles. 5. The ED-RN will prepare and hand off all medications from the outside to the inside. They will be in communication with the ICU RN. 6. Delegate tasks to the floor runner and does not need to be in PPE.
Coming from the ED will also be a backup doctor, MD2. They can bring up the glide scope and serve as backup for intubation. Thus, they must also be donned in full airborne contact droplet precautions.
RT2 is the RT runner, who will similarly assist RT1 from the outside.
In order to keep the team working efficiently, the area directly outside the room is only for the code team personnel. Observers should stay clear of this area outside the room. This area is delineated by the crash cart and bag.
For intubation, the EDRN will provide the team with an intubation bag with required medications. Prior to intubation, MD1 will do a check to see that 1. All team members have airborne PPE, and 2. That the door is closed. Missing items can still be given if the door is closed by EDRN, who will be in airborne PPE.
Communication is difficult during codes. It is very important to speak as clearly as possible. Closed-loop communication is also very important. For example, ICU RN1, I need 1 milligram of IV epinephrine.
Okay, MD1, 1 milligram IV epinephrine coming up.
All others should remain as quiet as possible throughout the code.
Following intubation, the door will be closed. Thus, communication should take place via the walkie-talkies that EDRN and ICURN will both be equipped with.
Prior to transfer, the EDRN will call the ICU to accept the patient. Once accepted, the code team will accompany the patient to the ICU, ensuring not to contaminate the environment en route. The EDRN, who is not contaminated, will assist them with this task. The team will doff in the ICU, ensuring they watch each other during the process.
It is important to debrief as a team as much as possible for continued learning and improvement. Thank you for listening.